Okay, good stuff. Okay, so if I don't see a hand come up, just interrupt me. Just stop and ask a question. Don't worry about hands going up and stuff like that. It's quite a small webinar today, so we can take advantage of that. So today we're going to run through our Docman automation product. We have 3 core products for EMIS. We have a normal pathology management platform. We have our Docman automation platform, and we have a repeat prescription support platform as well. All of the 3 products are built by us. They're all under the brand name MyBotGP, and they're all acquired individually. Okay, so let me start to run through this now. So today we're going to go through our automated Docman filing, MyBotGP product. And we caveated that, calling it, liberate your teams. So MyBotGP, and what is the MyBotGP range?
They were on the system a minute. They were on Docman.
Hang on, let me just see something.
Search for form. I can't find them.
Oh, we can hear someone in the background. Is it possible to mute, or Sanj, can you mute it? Okay, Sanj has muted everyone. Thank you. Okay, good stuff. Right, so essentially just Jeff and the MyBotGP. Oh, I think they're back again. Thank you. Right, so who we are, just a couple of minutes on who we are. We're an NHS ICT partner, which is quite important. So just to explain what that means, we are not an NHS organisation. We are a UK company, a private UK company. However, we do have a partnership with an NHS ICT. That's important because it means that we have access to NHS Cloud. Having access to NHS Cloud means that things like data sharing agreements and DTACs, DPIAs are much more straightforward. If you were to buy a MyBotGP, it will actually live in an NHS Cloud environment, and that's quite unusual and obviously a massive positive in terms of security and robustness. We completed a couple of HIN Innovation Launchpad programs, which are sort of government funded and NHS funded programs for launching innovative tech in the NHS and government. And we're supporting hundreds of federations and hundreds of practices, PCNs and federations across the country. So this particular tool has a DCB 0129 certification, which is an NHS required certification around safety and how it's built, and we can share copies of that. Our pathology management tool is also classed as a medical device, and our repeat prescription also has DCB 0129 certification. Okay, so all of our kit lives in NHS Cloud. We have DTACs, DPIAs, obviously so all safety is assured. We're experts obviously at working with EMIS and System 1. We've got different packages for PCNs and practices, and the mission is pretty straightforward. It's reduce practice costs, improve patient safety, and help you do more with less. So this slide isn't specifically in relation to Docman. It's just a conceptual slide around perceptions of time, because I think one of the things that we're not very good at as people is recognizing how long things take and where you can get time back. So if you think of the remit of 15 minutes a day, 15 minutes a day seems like a small amount of time, but in reality, over a period of a year, it is not a small amount of time. 15 minutes a day equates to 91.25 hours a year. So that's over 2 weeks' work based on a 40-hour working week. And most people work 32.5 hours when you take off breaks and stuff like that. So 15 minutes a day is 2 weeks over a year. So if you get back 15 minutes a day, that's 2 weeks. 30 minutes a day for one person is 4.5 weeks, which is 182 hours. So again, if you can find a way to get back, one person get back 30 minutes a day, they'll get back 4.5 weeks. If you've got 2, 3, 4 people get half an hour a day back each, you could be looking at 16 weeks, 4 months worth of physical capacity back again. And that's the principle behind our tooling. We can help you get time back by letting an automated platform take over some of your work. It's not going to replace you, but it will definitely take away a portion of your work, which will mean that you can have more time to focus on other things. So letter management obviously takes a lot longer than 60 minutes a day and a lot more than one person's involved. I'll tell you a bit about our tooling. This is the challenge, which you'll all be very aware of. We base our business case on a list of 8,500 patients, just because that's an average size practice at the moment in the UK. So if you take a practice with a list of 8,500 patients, that practice will receive about 125 letters a day, which is a staggering 39,000 letters a year. So that's 39,000 letters a year need to be validated, got onto the system, filed, actioned, and triaged. It's massively important work that's led by practice teams. It's very time consuming and often error prone. So all of those letters in the 8,500 list scenario, 39,000 of them, all of them must be filed, well, must be validated first that they are correct in terms of match to a patient and so on and so forth, and filed and coded. And when I say coded, I don't mean clinical decision coded, I mean letter coded. So that's 39,000 letters need to be filed and coded before anything's done with them. Some letters must be clinically coded and obviously seen by specific people or teams, and some letters do not need to be seen by anyone. They just need to be forwarded elsewhere or filed. So what the principle behind MyBotGP is to help you break the back of this very repetitive and time-consuming task in terms of making sure that all letters are validated, filed, coded, and distributed appropriately, and that only the correct people or only the relevant people see letters that they need to, and all of the rest are managed for them. And even in relation to people seeing the letters that they need to, the bulk of the work has been done for them. Now, the tooling works every day, 365 days a year. So you won't come in on a Monday and there'll be hundreds of letters in a queue. Obviously, if people are away or they're sick or people change roles and you've got shortages of staff, you won't feel that impact as much because you've got this automation running in the background that's doing the bundle of the work in the background for you. MyBotGP will pick up and file all letters. And based on this 8,500 list, you're looking at approximately 203 days a year to be got back in time allocation can be given back to the practice. No backlogs, it can remove errors, enforce standardization as well. So the right way to think about this tooling is like a Docman super user. Essentially, you're employing someone that wants to use Docman, they work 7 days a week, they don't make mistakes, and they're going to get everything onto the system and distribute it for you. Now, the principle behind where this tool starts and where it stops is it does not clinically code letters, so it will not read a letter and make a medical decision, but it does everything else. So if you look at the Docman template, if you think about what the challenges that we're cracking, that we've cracked with this tool, MyBotGP will recognize your letters as they come into the practice. It can pick up all letters. And it can pick up emails as well directly from Docman, so you can email letters to our tooling in Docman, and it will pick it up and it will run them through the platform. It will recognize the letter, and it will complete the Docman template for you by itself. It's not going to guess at what the letter is and then ask you to double check, which is time wasting because we can't see value in half completing something and then sending it to you to say, do you agree or do you disagree? It will actually complete the Docman template for you. It will validate the patient. It will code the letter type in terms of what type of letter it is. It will know what date to look for on the letter. It will know, is it the date at the top of the page or the middle of the page or the bottom of the page? It will know the hospital and department, and it will complete the Docman template. If you want letters always invisible or visible, you can say, or for all these letters types, make them visible, all these not visible. You can set the rules in advance. It uses all of the Docman functionality. It can also pick up private letters. So more recently, lots of our clients have started to receive lots of private letters, particularly in terms of the weight loss medication. So we sent a patch out so our tooling can pick that up as well and look after those. Obviously, there's a different way that you would validate those letters. So MyBotGP is going to grab all of your letters. It's going to read them all. It's going to validate them all. It's going to complete the Docman template for you. It's going to ensure that all of your rules are applied using all of the Docman functionality. It's going to complete the template as a phase one. Obviously, as I said before, it works every day. It's not going to make mistakes. It will process stuff quickly. Once it's up and running, it processes the letters really quickly. So you'll always be on zero, notwithstanding how many you get each day, it's always going to take it back down to zero. So you won't have anything in unfiled. And it's basically a Docman super user. So once we've done the first part, Essentially, it's all very well that the tooling can pick up and recognize a letter. The next question is, what do you want done with that letter? So, it goes without saying, and everyone on this call will know that all practices have got different letter management flows that are actioned through Docman. So what that means is that different practices will have a different approach to how they manage their letters. Some will want some letters going to specific coding teams. Others will want letters going to particular clinicians. Others will want stuff pushed through templates. Others set tasks. You've all got your own way that you've built up over the years of managing what you do with letters afterwards. Now, what this tooling will do essentially is it can replicate that for you. So we will teach it to recognize all of the letters for you. And then you tell us what you want done with each letter. So we have some clients that say, we want MyBotGP to file everything, code all letter types. Yep, so that will be done straight off the bat. And then they say, we want these particular letters just put into these folders because we've got teams that work out of these folders, and they will pick the letters up from there. Other clients say, yep, triage to the usual GP. Yep, MyBotGP can do that. Other clients say, yep, we push everything through templates. Can you please use these templates? We'll say, yep, we'll direct the MyBotGP once it's validated the letter to push it through the template. Others will say coding teams. Others will say set tasks. And we've got other clients that use a combination of everything. In addition to that, you receive thousands of letters a year that you generally don't need to look at. Stuff like pharmacy letters. So, for example, all pharmacy letters can just be picked up, validated, got onto the system, filed, and triaged to a different team or a different folder. There's no reason why at the practice you need to see those letters unless you're not linked with the pharmacy team, and then you may want to see them. So they can just be got onto the system and gone. So now you don't have to look at those anymore. In addition to that, you've got 111s, DNAs, negative retinopathies, which the bulk of those you don't need to see. So MyBotGP will file them, validate them, and file them, and you don't need to see them. Now, of course, there are in some scenarios where you may need to see a 111 letter. Could be that there's a warning on there, patient might have attempted suicide. So MyBotGP will also read the letters, and if it spots any warning messages, it will know in its brain that I've been told I don't need to show these to anyone. I can just file them, so I can save them time, unless I see a warning on that letter. And if I see a warning on that letter, then this particular practice says, well, I want them put in this folder or push through this template, and it will do it for you by itself in the background. So the principle behind this tooling, if you take it back to the business case at the beginning, is invariably people, when they look to try and solve problems, they try to go for the most complicated bit. What we're saying is the most complicated bit, you still need a human for. We still need humans, despite what you hear from other suppliers. There is no tooling out there other than a human being at the moment that can read 5 pages of a letter, written from scratch from a hospital, and make a medical decision and action that medical decision. That's for a person to do. And in our opinion, that we're 4, 5, 6, 7 years away from that being safe to start to support that function as well. So what is the challenge that we're left with remaining? Well, we're left with this challenge that an average GP practice is getting 39,000 letters a year, every single year, and that number is increasing every year. That's 39,000 letters that need to be validated, got onto the system, filed, triaged, important ones spotted, got to the right people, non-important ones filed and removed. So we can free 203 days a year for an average practice of physical time and capacity, ensure that letters are picked up and dealt with that day. There's no more waiting lists. Ensure important letters are picked out and sent to the right place, so action can be taken at the right pace to make sure your patients are looked after. And then in addition to that, obviously, because MyBotGP is a super user of Docman, you can still use all of the functionality that you have in Docman already in terms of what you want done with those letters, where you want them sent, and how you want them looked after. So it's a massive workhorse that runs in the background. 7 days a week, 365 days a year, grabbing everything, validating everything, filing everything, getting it onto the system, making sure you don't need to look at hundreds of thousands of letters, every few years, because it's done it for you, and just leaving you with the letters that you need to see. Now, in addition to that, it goes without saying that this type of kit has a very, very complex reporting log, audit log. So this is a high level view of that. Full analytics and audit log. So every single letter that passes through the platform, it will keep a note of, so that you can do reconciliations and you can check and you can make sure that everything is being dealt with. And any letters it hasn't seen before and it's seen for the first time, it will flag up and say, I've never seen this letter before. Maybe the hospital's changed the format, or it's a new letter. What do you want me to do with it? And then within a couple of minutes, you can make some changes, teach it to recognize that letter. And then the next time it sees that letter, it won't ask you, it will know what to do. It will know to file it, validate it, get it onto the system, and then either file it somewhere and triage it so no one needs to see it because it's not one you need to see, or get it in front of the right person so the right person can look at that and then make a decision about what needs to happen for that patient based on what they've read on that letter. Further to that, and there's a very detailed granular breakdown. You still have your full audits in EMIS and Docman because the tooling uses EMIS and Docman, so no concern around that. Nothing's going to change. You're probably experts already at using that tooling and working out where stuff is done. You'll still have access to all of that. This is an additional layer on top of that, so you have a separate reporting log. And we send a spreadsheet at the end of every day confirming what MyBotGP has done to whoever wants that spreadsheet. There's generally a small distribution list. And in addition to that, there's a full audit log in MyBotGP as well. So you can log in and check all of that whenever you like. So the way that we price is very straightforward. We are out, we believe our pricing is extremely competitive. We want to be in, 1,000 GP practices, 2,000 GP practices, 3,000 practices. So we made the pricing absorbable by large and small practices. We have a subscription model, unlimited letters and unlimited volumes, so you can put everything through the tooling. It's not based on specific letters only, or you pay more or what have you. This is an unlimited letters and volumes. And the way that we charge based on one practice is 1999 and then list times 30 pence. Now, in addition to that, and that includes configuration, we will configure the tool for you. In addition to that, there's a cost for NHS Cloud, which is where your MyBotGP will live, which is based on your list size. So without overcomplicating that description, based on the 8,500 list, you're looking at a cost of approximately £5,000 a year, 5137, for unlimited letters and unlimited letter types and volumes, and that's configured. Now, if you took a second product from us, pathology management perhaps, or repeat prescriptions, then there's a reduction in price, which we can cover off in another call, or if people are interested at looking at both products. So just to take this back to the beginning, and then what I want to do is stop for questions. We found that we like to make our webinars very interactive. You're all experts in letter management, so you're going to have your questions to try and validate where this tool starts and stops in your head to understand how it will fit into your workflow, and we welcome those. So all of your kit will live in NHS Cloud, so it's locked down, safe and secure. So that's massively important, hence why we can have a logo, an NHS logo on here. That's confirmation that we use NHS Cloud. All of your kit will be, MyBotGP is logged in there. You don't need to have a computer at the practice or anything like that. You'll access it by logging into it. This particular tool has a DCB 0129. If there are PCNs on this call, we have PCN and practice packages. The pricing is fairly similar, but at PCN level, what we do is we allocate a specific account manager, and we can give you detailed reporting at practice level on each practice, What that does is that helps you make sure that everyone gets to make best use of the tooling and no one is left behind. So in some scenarios with PCN acquisitions, some of the practices do really well really quickly. Others take a little bit longer to get used to using the tool and might need a bit more support. So what we do from our end is we can see that. We can't see any patient data or anything like that, but we can see how many letters the tooling is given permission to look after for the practice each day. And if we see that that figure is low, we can ping an email out and say, hey, looks like you're only managing to file 200 letters a day or 50 letters a day or 100 letters a day, based on your colleagues across the PCN. They might be different size practices, but they're averaging about this many letters a day. Do you need some help? And then what that does is ensure that the whole PCN benefits if you've acquired a PCN level. At practice level, we can still see those stats and you'll still get the notifications. So we've got a client success manager who'll keep in close contact with you. The principle behind this tooling is to save time, enforce standardization, and to make sure that letters are processed quickly and the right letters are gone to the right people. As I said before, NHS stats, unbelievably, an average list of 8,500 patients is receiving about 39,000 letters a year. It's 125 a day, and that figure is growing. All of those letters need to be validated, filed, got onto the system, filed against the patient record, and the letters need to be coded, all of them. And MyBotGP will do that for all of them by itself. Notwithstanding that, some letters you do not need to see. They can be triaged elsewhere, pharmacy teams, or just filed. And other letters must be seen by specific people. And depending on where you want them put, MyBotGP will put them there. It will recognize them and it will put them in a folder, push them through a template, set a task, wherever you want it. So what you're left with is your skilled people who are able to read the letters and make decisions around who needs to see them or what action needs to happen themselves. They are just looking at those, not everything else. All of the rest of the noise is gone. And they are looking at those letters once they're already on the system. They're not having to sit there and validate NHS numbers and double check dates and click buttons for every 39,000 times a year before they read the whole letter. That's all done for them. So there's a massive time saving there as well. Obviously, as I touched on, this is an automated platform. It works 365 days a year. So holidays, weekends, sick leave, people leaving, you've got a baseline of that being done in the background 24/7, 365. And it will clear your backlogs if you have any fairly quickly. And it will reclaim an average of 203 days a year in time allocation. It loves Docman. It's a Docman super user. So it's the dream scenario. You're employing someone that just wants to push letters through Docman all day long. And it will do that. It's going to grab all of the letters, read all of the letters, complete the Docman template by itself, and file it. And just to cover what we said before, it knows that for a particular letter, it should take the date from the middle of the page, not the top of the page, or different naming conventions. It will understand all of that and validate it, complete the Docman template by itself, code the letter type, file it. It can also look after private letters and NHS letters. It can grab everything, all letters and emails from Docman, so you can forward emails to it, and it will get everything onto the system every day, 7 days a week. And then you tell us what you want done with those letters. And that's because all of you will have a different approach to Docman, essentially. Some will want everything in a file. We have some clients want to push everything through templates. Okay, so they do that. Other clients say, no, we want everything in a folder, and then everyone just works out that folder. So, okay, so that's all Docman functionality. Nothing's changed. Our tooling will do it for you. And other clients have a combination of all different things, folders, templates, tasks, triage to usual GPs. And then obviously, as I touched on before, there's thousands and thousands of letters a year you do not need to see. So you don't need to see them anymore, and you'll save time there. Pharmacy letters, it can be recognized and triaged straight away if you want them to or not. they'll all be filed anyway. 111's DNAs, negative retinopathies, all that whole batch of letters can be filed without you seeing them, unless there's a warning on those letters that means they should be seen, and then it links back up to here. Where do you want it to go? And then we can tell MyBotGP to do that. Full audit log, and obviously we price based on an unlimited letters and volumes on an annual subscription. 1999, list times 30 pence, and then based on how many patients you've got, 7 pence, 6 pence, or 5 pence. But essentially for that 8,500 list, that works out at an average of 5,137 plus VAT for unlimited letters and types and unlimited volumes. So that's enough of me talking for the moment. Do we have any questions? I've just gone on pause for a minute. If you want to pop a question into the chat, or you want to come and off mute and you want to say something, please do.
Hi, it's Laura Shayla. Can I ask a question?
Yeah,
Much about duplicates. So in Oxford, we have a real high rate of it's about 13%, I think, of our letters are duplicates. How does it deal with those?
okay, so that's that. Yeah, I mean, duplicates are challenging. So we do not touch them as well, unfortunately. We made the decision with the tooling in. It will still file them, obviously, but we don't delete. Sorry, do you mean in deleting off the duplicates or filing the duplicates?
Yeah, so does it recognise it as a duplicate? What will it do? Just file it?
Yeah. It will still
We'll just have
file it.
multiple. Sometimes we can
Yes.
get 2, 3, 4 copies of this same letter.
Yeah. There's lots of practices have the same challenge. So the challenge for us and why we decided to not attempt to delete letters is that sometimes there can be some very small nuances in the letters. So
Yeah.
once we start to delete stuff, then it opens up. Well, yeah, I mean, it sounds like from your action, you agree. You know what, if we start deleting stuff, we could delete something that's important. We are looking at how to do that, and this tool can be patch updated. You know, like a mobile phone, periodically we send out a patch and we say log out, log back in, and there'll be increased functionality, and that's on our bucket list of patch updates for the future. So we're looking at a way of safely doing that. But as of today, we've made the decision to not touch those, as annoying as that is. And the feedback from our clients is essentially they're still having to double check the duplicates. Obviously, it will still file, but they're not having to do everything else. So it's sort of 6 of one and half a dozen of the other.
Thank you.
Thanks. Any other questions? So is any, I mean, just coming back to the feedback from here, does all of this make sense? And how are you all sort of using similar approaches? Are you using tasks or templates, or do you have coding teams? Okay, fine. Okay, so yeah, Laura.
I was just going to say we're outsourcing it at the minute, but the costs are going through the roof, and we're charged per letter, hence why the duplicates is such an issue.
Oh, got you.
Yeah, so we're just looking at all our but we don't have a coding team, so the big advantage of the outsource is they do all the coding. So I think that's where our
Okay.
skill gap is really.
Okay, so we've got some clients in a similar position. So are you without obviously I'm not asking any detail about who's doing it and stuff, but are they looking at how or rather, let me think of a different way of asking this. How are you deciding what they see that needs coding? Because as I understand it, again, some of our clients employ a specialist to clinically code and a portion of letters for them. And as you say, that the companies generally charge by the letter. So that's locked down by a particular selection of letter types, and then they charge you to do those and make the potential medical decisions off the back of that. But I guess, how are you deciding which ones they see? Because presumably they don't need to see all of them.
No, they don't see everything. So we've just got protocol set up of which ones they see and which ones they don't, and then which ones we do in-house. So something like an A&E letter we would do in-house. The 111s, DNAs, all that sort of stuff we do in-house.
Okay, so
And like clinic letters, discharge, go via them and then back to us for like meds. They don't do like med changes or anything like that, but they just do all the, the coding, the quaff coding and things like that.
okay, fine. So in the scenario for your practice, if this was of interest, it would take over what you're doing at your end, if that makes sense. So you wouldn't need to do that. The tooling would manage everything other than that, and it would pick up the remaining letters and forward them over, unless you've got another mechanism, and forward them to the outsourced company that will then sort of
This
clinically
would cover
code
what
them.
we're doing in-house.
Yes. Yeah.
Yeah.
So
Okay.
what it's going to do is it's going to grab, because you've still got to, presumably you still have to get them onto the system. So you
Yes.
and yeah, so that
Wow. They do that. So they get them. They do the file. They file them.
so they log into Docman. So they've got a
Yeah.
remote.
Yeah.
Yeah, got you. Yeah. So yeah, it's what the other. I think I know that there's 2 or 3 companies that do that. So
Yeah.
they'll have a Docman username and password. They'll log into Docman. They'll grab your letters. They'll pick out the ones that they need.
Yeah.
They'll validate them, file them, code them, and then send you a report. So what our tooling would do is it would sit one stage before that. And before them, it's gonna grab everything. It's gonna validate everything. It's gonna complete the document template for everything. And then what it would do is the letters that you want them to see, they would get some kind of audit log or report, or they can go and find those letters so that they can make the clinical decisions based on that, because obviously you need the support in that area. And the remaining letters would be dealt with by itself. So your team in principle wouldn't have to do anything. That's
Yeah.
that whole function would
Yeah.
be gone.
Okay. Thank you.
No, thank you. So any other questions? It's interesting because we've actually had some of those companies approach us to automate some of the other letters that are passing through their systems, as well as a way of sort of standardizing and driving down costs for them as well. So we've got sort of people looking at our tooling at practice level and then at outsource level as well. Okay, so I'm going to stop sharing my screen and I'm just going to open up another folder here. We'll show you a quick demo of the tooling working. I'll let Sanj talk through this, because I think everyone's probably heard enough of me. 1 second, demo. Okay, so I'm just going to pause this and then I'm going to re-share my screen again. Open up here. Okay, Sanj, over to you.
Thank you. Yeah, sure. Okay, so let's just start the video. Okay, so what we're focusing on here, this is MyBotGP. If you just sort of pause it there, James. So basically, the way that MyBotGP files documents, essentially, they need to be trained. So the system needs to be trained on how to read and extract relevant bits of information in order for it to file. So, for example, what you would do, there are 5 steps within the platform. Invariably, we do all of this anyway. So, but again, it is a self-configurable platform. So if there are any ad hoc letters that you need to do yourself, you can. It's quite easy to do. But as I say, this is all part of the service that our team would effectively reconfigure all of the documents for you. And so if I sort of give you a quick tour of how we do that, essentially there are 5 steps. MyBotGP logs into Docman. It extracts every single document within your not in folder. It grabs it and pops it into this platform, into the MyBotGP platform. And then what it looks to do is effectively classify the type of document. So again, for example, you know, what does an oncology letter look like? What does a gynecology letter look like? 111s, etc. Emergency discharge. So effectively, it goes through all of the different types of letters, and then through the steps 1 to 5, we look to classify those letters. So we give that document type a name. The way we classify letters are looking for a keyword or a collection of keywords. So coming back to the oncology example, look for the keyword oncology, and essentially that would classify that type of letter. And so once we've classified the letter, we would then give it the additional information to file it. So for example, where to pick up the event date. If you just play the video, James, just to take it to step 2. Again, we're just going to give it, this one's an ENT clinic letter. So again, we've given it the ENT clinic letter, given it some keywords to pick up so it can uniquely classify this letter. Okay, keyword to search, that's fine. So step 2, we go to step 2. So again, in step 2, we would show where it would pick up the NHS number, because obviously it needs to validate that letter against the patient. You would then specify the event date. Again, where is that event date? What type of date do you want to use? Discharge date, appointment date, letter date, current date. Lots of different options in how you can define the event date or when it files within Docman. So we save that. We go to step 3. We tell it the name of the hospital. Again, we just give it the name, the department. Again, if you want to post it to a specific department. Step 4, just pause it here because I'm not going to be able to talk that quick. So step 4, again, if you use in-house templates, you can just tell it the name of the template for MyBotGP to pick up. Description, you can give it a standardized description. So again, it will always populate that description within Docman every time it sees this letter. Folder. Again, coming back to that, what folder you want to put it against. Notes and tags, don't really see that used quite often. And then step 5. In step 5, you've got the ability to actually create tasks and stuff based on the actual letter type. You've also got a few other things that we can do here with tasks. I'll just let it wait to go to the next screen. So essentially here, you've got sort of 3 options for create review. You can obviously send it to a coding team. You can send it to the usual GP. So MyBotGP's got the ability to, understand who the usual GP is for that patient, and it will automatically create this letter against that GP. You've also got the ability to, based on specific keywords, filter that letter and push it to a different team based on specific or sensitive words like police or suicide or 2-week wait, things like that. So you could have the oncology or an emergency discharge letter going to maybe not going to a coding team, but then again, if it did see specific keywords, you want it to go to a coding team. So again, just sort of demonstrating that flexibility based on specific keywords. You can signpost that letter to different teams within your practice or different task names. Okay, again, so we sort of covered create review. You also got clinical code and person. Again, what you would, if you use those fields within Docman, you would just simply tell it the name or text description. And that's it. And as soon as we've done that, that's enabled. So that document is now trained. And that's the sort of process that our team would go through in training all of your letter types. And essentially, every time it sees that letter, it's then got a standardized set of rules of how it will file that letter. And this is just the automation kicking in terms of how it logs on. No different to a user. It's just like a remote user. As James has mentioned, you would provide it with a user ID and password. It would log onto Docman. It would navigate to not in folder. Based on all the classifications that you've trained, or that we've trained it on rather, it knows all of the information in how to file that document. End of day, it would then send you a status report. You can either get that information from the platform, or it sends a 5 p.m. status report email to your inbox daily. And that's it.
Thanks, Ange. So essentially what you're seeing here, it's been redacted. Some of our clients let us film to use for demos, hence the redaction on here. Is like a ghost. The way to visualize this is if you've got someone logging in from home and the keyboard is moving around, the mouse is moving around the screen, and the keyboard is going by itself. So this is MyBotGP working. It's using Docman. It's recognized that letter. It's completing the Docman template by itself. So it's like a Docman super user based in another location. And it's dealt with that one already. Then it's moving on to the next letter. It's going to pick it up. It's going to look at that and say, have I got permission to action that letter? Yeah, I recognise that letter. I've been told what to do with it. I know where to send it. That it's done. It's dealt with it, and it will deal with it, and it will triage it, set tasks, as Sam said, file it, don't file it, use your GP wherever you want, and then it's going to move on to the next letter. The training of the letters we do ourselves, so we'll get it up and running, as Sanj said, for you. We run a regular weekly training webinar for this tool and all of our tools, and then we post all of our webinars on our training channel. They're open invites. Clients tend to come to a couple of webinars because obviously you're going to want to know how to use the tooling yourself as well, especially when it comes to audit logs and so on and so forth. So I believe the Docman one is every Friday. Path is pathology is every Tuesday. You come along, join it. You can come to as many as you like or as few as you like, and then that's it, and then we're off. But in principle, the phase one is for us to grab all the letters, teach it to recognize all of the letters, and then phase two, which is the bit that you're going to be most interested in. It doesn't take a massive amount of time. We generally have a couple of calls, about an hour each one over a period of a few weeks, and say, right, put this letter here, put that letter there, that one goes to this team, that one goes to that team. We do that, sign it off, and send you a report, and then MyBotGP will just run in the background. And then what you'll find is obviously some letters change or letter types change. They'll pop into the platform. It will flag up and say, hi, never seen this one before. What do you want to do with it? And then hopefully, once you've been using the tooling for a while, you'll be able to just add that letter yourself. It'll take you a couple of minutes. You'll know how to do it and just go up. Or you can give us a nudge and just say, can you just load this letter onto the system for us? We'll add that letter for you, tell it where you want it sent, and it will just keep running in the background. So the way that your work will change, it will change in more around monitoring the tool, understanding the tool, seeing what it's done. And then obviously you'll have your reconciliation work as well. So that sort of wraps up everything from our end. Any questions before we finish up? No. Okay, cool, brilliant. Okay, well, thank you. We will share this webinar online afterwards. We share all of our webinars. We give us a couple of days to get them onto our YouTube channel, and we'll do that, and then we'll send you an email with a summary of it. And if you've got any questions, then please let us know. But thank you for joining.